Hi, this is Dr. Sham, and let's talk about the antipsychotics. So, there are two types of antipsychotics, and we're going to discuss them separately: typical antipsychotics and atypical antipsychotics. Typical are haloperidol, a very popular drug, and chlorpromazine, and atypical are clozapine, olanzapine, quetiapine, aripiprazole, risperidone. These are the new antipsychotics. So let's move forward. So first of all, atypical antipsychotics, if we talk about, so what were they? Clozapine, olanzapine, quetiapine, risperidone, aripiprazole. So these are actually what is the mechanism of action. So we're going to discuss mechanism of action, indications, side effects, and the contraindications, if any. So atypical are D1, D2, D4, 5-HT3 antagonists. Okay, and why these antipsychotics atypical, where they are used in the patients with the schizophrenia, mania, bipolar disorders. Okay, and these are the indications. So what are the side effects of these atypical antipsychotics? So all the atypical antipsychotics, they are with the weight gain, and there is a risk of VTE, venous thromboembolism, with antipsychotics. Um, if we talk about individually about what the side effects related to the atypical antipsychotics, so olanzapine, that causes dyslipidemia. All of the atypical antipsychotics, okay, they cause dyslipidemias, but which causes the more? Olanzapine. Clozapine causes agranulocytosis and the myocarditis, and that's why it should be used after the other atypical antipsychotics have been used. We never use this one as a first one. If we have to prescribe atypical antipsychotics, go for the others. If they are not working, then come to the clozapine, because you can see a serious side effect profile related with clozapine. The aripiprazole, it has a better side effect profile um, um, as compared to the other atypical antipsychotics. So weight gain, venous thromboembolism, that's generally related to all the atypical antipsychotics. Then individually, olanzapine causes more dyslipidemia, clozapine with agranulocytosis and myocarditis. Aripiprazole has a good side effect profile. Now come to the other side effects. That is, they have the anti-muscarinic side effects: dry mouth, constipation, urinary retention. Then they are related with the neuroleptic malignant syndrome. Antipsychotics are related with neuroleptic malignant syndrome, and they decrease the seizure threshold. Okay, so far we are talking about atypical antipsychotics. Now let's move towards but first discuss the contraindication. So contraindication is particularly when you are giving in the IM form, um, intramuscular injections. So don't give in the acute myocardial infarction, sick sinus syndrome, bradycardia, severe hypotension. So intramuscular injection, that is contraindicated in of atypical antipsychotics in these conditions. Now let's talk towards the typical antipsychotics, and these are old antipsychotics like haloperidol and chlorpromazine. And what's the mechanism of action? They are D2 receptor antagonists. These are D2 receptor antagonists. Okay, so D2 receptor antagonists, typical antipsychotics. Now let's move towards their indication. So indication same as the atypical antipsychotics, that is schizophrenia, bipolar disorders, and they are also used in as a palliative medicine. Haloperidol particularly, that's used for the breathlessness and the confusion and the nausea and vomiting in those patients who are in the palliative care. If we talk about the side effect profile, um, the side effect profile is arrhythmias. You know that the haloperidol, you need to remember that that is associated with long QT syndrome. Um, Yeah, and the other side effects are they make the patient drowsy, hypotension, hyperglycemia, and importantly, you need to remember the extrapyramidal symptoms. Okay, extrapyramidal syndrome that is related with the typical antipsychotic. What is there? So you have features like Parkinson, you have acute dystonia like torticollis or oculogyric crisis, akathisia, that is severe restlessness, and tardive dyskinesia. What is that? That is the late onset of chorioathetide movement. So this is with the um, typical antipsychotics. The other things that are related, that is hyperprolactinemia, again neuroleptic malignant syndrome, reduced seizure threshold. So they are there with the typical antipsychotics. But extrapyramidal, you need to remember that. Contraindication, it causes long QT. So if somebody is having a long QT, don't give that one. And the Lewy body dementia and the Parkinson, these are contraindications of using this typical antipsychotic.